Hey, everybody. I'm Dr. Anthony Cave, a Stanford and Harvard trained anesthesiologist and integrative medicine specialist. And it breaks my heart when I see how health advice is twisted and turned in ways on social media and the internet that end up hurting my patients in ways that they don't even know are happening to their body. And I wanted to share today a couple of those tricks, a couple of those pitfalls that so many of my patients fall into, and how I think it's wrong because they're often at the expense of someone making money off of them. So it's kind of late tonight. I'm thrilled to see so many people already coming in. Heidi, Chris, good to see you, and Darian. I hope everyone's having a good night, and I hope you're all ready to learn my perspective that is, I think, very valid to everybody out there, because we all have bodies that are susceptible to falling into scams from supplement companies and from self-proclaimed health gurus and health nuts that have never actually taken the responsibility of holding someone's life in their hands. I completely buy into the scientific method, no question. My beef with the health industry is when health advice, especially from podcasters and YouTubers and et cetera, is not actually using proper scientific methodology and making money off of patients. Because most of these self-proclaimed health gurus probably have never looked a patient in the eye, or their parents or their children or their loved ones, and held their hand and said, I am going to take care of your loved one. They are under my responsibility, and I will do everything in my power to deliver them safely and comfortably back to you. It's a tremendous amount of responsibility that we take in the operating room. Me as an anesthesiologist, I'm also an integrative medicine specialist, so I believe in natural methods whenever possible. But at the right time in the right place, we have to use synthetic medications to do miraculous things in medicine. But with that amount of responsibility, it means that I am very, very critical when people try to use medicine and science, quote, science, to do less evidence-based and potentially harmful things to patients before they come to my operating room, or if they come to my ketamine infusion clinic from a lifelong of losing their loci of control. If there's one thing I want you all to take away tonight, it's that us losing our loci of control is responsible for an incredible number of ailments that come, mental and physical, debilitating conditions that my patients struggle with inside the operating room and outside the operating room in my ketamine infusion clinic. Sailboat RN, good to see you. Doggy, good to see you. Jay, Rebecca, and everyone. I'm happy you're all making it in despite the late time. So the first question is, what is the loci of control, and why is it the most important part of us tapping into our healing potential? It's so simple. The loci of control refers to either an internal loci or an external loci, meaning our control is derived from our internal doings, our body, our mind, soul, etc., if one believes in a soul, or an external loci, something like, gee, I don't know, a supplement, a medication, some health coach telling us what to do. I'm not saying any of these are wrong. And I prescribe medications all the time, and I use them for life-saving purposes. But we all need to admit, doctors, patients alike, that when we are prescribing a medication, we are changing our patient's body and their brain chemistry, because they are placing some element of control in a pill, in a procedure, in a medical device. I'm not saying it's wrong. These are often life-saving and fantastic tools in medicine. But we need to know the risks anytime we're recommending, especially if we're not actually trained well and we're not doctors who have had to carry the responsibility of someone's life. So what's so wrong about supplements? Everyone asks me. They say they're natural. Natural things are good, aren't they? Well, we just said that losing your loci of control has consequences. And we'll discuss that in a minute, because some of the studies, in particular out of Stanford, are fascinating about what happens to our brain chemistry when we begin to believe in something else having control over our body. But more practically speaking, the sheer amount of controversy and contamination in supplements is something is something that the majority of my patients who are taking loads of supplements have no idea about. And this really matters because most of my patients also don't know that their prescription pharmaceuticals might be contaminated with carcinogens. I'm not saying they're bad, and I prescribe them and use them every day. However, we need to know that there are risks with anything we put in our body. The food we eat, the water we drink, the air we breathe, the people we surround ourselves with, but importantly, highly purified compounds that don't exist in nature, like pharmaceuticals. I don't know if you're all are aware of metformin's contamination in the last couple of years from multiple different suppliers. Key example of so many of my patients taking metformin for longevity purposes. But if you're supplementing with something with a theoretical advantage of longevity, with a real concern for contamination from carcinogens, what's the risk and benefit there? This is what I do with my patients all the time is I need to weigh risk and benefit when they're in the operating room. If they want to have a psychedelic medicine treatment with me, it's not fully one or the other because everything we do in medicine, from placing an IV to intubating to going through a psychedelic experience, they all have risks. And just delivering these things as a one-sided benefit to all can be dangerous to so many patients unknowingly, either to their wallet, to their psyche, or to their body in the case of contaminants. Uh, Heidi is talking about fish oil, classic example that my patients have no idea about. Now, essential fatty acids are essential because we need to consume them. They need to enter our body somehow. But what's not talked about is the risk from association studies that show fish oil and atrial fibrillation. And my concern here is that, yes, essential fatty acids are absolutely necessary. And a lot of studies show benefit, a lot of them don't, for things as wide ranging as depression, anxiety, heart disease. But when it comes down to my patient, what are the risks? Atrial fibrillation, if you're familiar with it, I don't know. It's really important to know because when you have atrial fibrillation and you need to go on beta blockers or calcium channel blockers or blood thinners, you're increasing your risk of depression because beta blockers in some patients are not tolerated well. It helps them or just makes them feel crummy. If you're going on blood thinners, you're risking a brain bleed if you trip and fall. These are serious risks from a condition that if we can prevent it, I would do anything for my patients in the right context to minimize the risk of developing atrial fibrillation. And that big study that everyone cites about the prescription omega-3 fatty acid, well, it hasn't really been reproduced in other studies. And it comes down to, do people touting these studies actually know the data and look at that? Well, in that study that showed 25% risk reduction for cardiovascular outcomes, the placebo arm was given mineral oil. Maybe the mineral oil was hurting those patients, and therefore the EPA or the omega-3 supplementation group looked better compared to mineral oil. This is the level of detail that when we're making recommendations for things that might have real harm, anything can be contaminated with a carcinogen or with a heavy metal if you're talking about turmeric or other supplements, anything from the ground, cough, cough, all those herbs are all at risk of absorbing arsenic, lead, mercury, anything that's been in the soil that they grew in. When we're purifying these potentially healthy plants into little capsules, you may also be concentrating all the contaminants that they grew in. Same with marine sources of omega-3s, all of the microplastics and PCBs and everything out in the ocean, whether it's a small fish or a big fish, it doesn't matter. When there's a whole food plant source base for things, and it can be whole food animal source, that's fine if the animal sources are appropriate. But when we start to supplement and start to look at an external loci of control, we risk not only losing control of our body, which we'll now talk about now that we talked about the real risks of contamination. And by the way, in case you weren't aware, Chantix, loads of angiotensin receptor blockers, a form of antihypertensive medication, very important life-saving medications when they're needed. These have also both had concerns from nitrosamines and NDMA, which are known carcinogens, have led to numerous recalls. Pfizer's been in the news a lot recently because of this, but they're not alone. Many suppliers. And that's in addition to metformin. How about ranitidine or Zantac, the histamine blocker for heartburn? Well, gosh, when we're just taking, patients end up taking histamine blockers for years and years because they have acid reflux for years and years. But do we talk about the side effects or the risks of contamination? And the same goes for SSRIs and for antidepressants. In my ketamine infusion clinic, it's not a lifetime of ketamine. This is a few number of sessions to help lower the requirements, if possible, for other medications. I would not advocate for a lifelong of a psychedelic. Just like how in the operating room, I don't advocate for a lifelong of anesthesia. I don't want my patients to be under anesthesia forever. It's giving the right medications at the right dose, at the right time, with the right risk benefit consideration. So, um, I'm looking at Jay's comment. The trust we put in our doctors is huge. Trust they'll keep us safe. And Jay, you're right. And the same should go for health advice from anyone else. And that's why I'm so critical of the health advice that I see all over the internet from people that have never actually had to carry someone's life under their responsibility. Because it's very easy to make recommendations not knowing who the patient is, not there not even being a provider patient connection there. How can we actually heal? I am always concerned about people trying to make money off of exploiting the vulnerable people out there. But more importantly, and this is what I promised, is the discussion of the external loci of control. And what I want all my patients and anyone who's listening to always recognize, because when we believe in something that's going to make us well, that comes from the outside, we risk sometimes sabotaging our own potential to take control. The classic example is this observational study from the UK, where they looked at patients that were on the borderline of needing blood pressure medication. So they're hypertensive, they have high blood pressure, and high blood pressure is bad. Something has to be done about it, either natural methods or non natural methods. I don't care, because we need to ultimately get the blood pressure down safely. But when patients are given a medication, those patients, compared to those that are given lifestyle counseling, the ones that are given the medication are less likely to implement other healthy lifestyle factors like losing weight, for example. Um, Now, this is an association study, so it's not a cause and effect by any means, but what more evidence do we need when there are safe alternatives to many of the recommendations that I hear people giving online and from my fellow physicians as well, who run the proverbial pill mill? I'm not speaking ill of anyone, and pills are often necessary. They can be life saving. But are they designed to be given for a lifelong? And what are we giving up in our power when we resort to medications? Um, Heidi's asking, can BP meds help the kidneys? Absolutely, because one of the the number one cause of kidney disease is diabetes now in the world, but hypertension is also dangerous for kidneys. And hypertensive renal disease is very real. And that's why blood pressure, one of the many reasons why blood pressure needs to be under control, in addition to risk of heart disease, strokes, etc. Chris is asking, at what point do you challenge your doctor if they are recommending these supplements over prescription? Chris, that's a very good question. We had a whole video last week on difficult patients. And I know you're not a difficult person at all, but you ask a good question, because unfortunately, some patients do get labeled as challenging or difficult when they ask very reasonable questions. And uh, your question here about how do you challenge? There is no blanket answer, because it depends on the context. And it often depends on the risk benefit. So the most, if you will, contextually agnostic, the most appropriate thing to always ask is, Doc, what are the risks and the benefits of me taking the prescription versus a supplement versus nothing? Risk and benefits. And the more we appreciate the risks and benefits, the better we can decide for ourselves. And ultimately, and this is the third part that health gurus don't talk about online, we can ultimately adopt a sustainable lifestyle. Just today, I was listening to a podcast from a prominent YouTuber. They're a scientist at a big name institution. They've never treated a patient in their life. And I don't think that this individual actually appreciates the intricacies and the complexities of patients' lives. So if you're going to recommend a supplement and that you got to add this powder to this food so you get the maximal extraction of this compound, that's all been shown to be helpful in a petri dish. Well, first of all, your study was in a petri dish. Brother, we're talking about patients' lives and human bodies that are infinitely more complex than a petri dish. I always am critical of studies that make grandiose claims off of looking at a petri dish because many things don't play out from the petri dish to the rat to the human being. And if they did, if you want proof of this, pharmaceutical companies wouldn't have a giant funnel of a bajillion potential candidates funneled down into one candidate that actually works in a randomized, controlled, double blinded trial. It's because throughout the course of theory in the computer, applied in a petri dish, applied in rats, by the time it reaches a human, you may have lost all the efficacy because humans aren't the same as a computer simulation and aren't the same as a rat. I'm not saying that this method is bad, but I'm saying that when we begin to make grandiose outcome, when we start to make big claims, pardon, from studies that were never done in humans, and now we're going to start recommending complicated lifestyle changes to a patient. Yeah, take this supplement, it costs this much, but it's worth it for your longevity, and mix it with this supplement. And before you know it, this is expensive stuff, the risk of contaminants, because heck, if our prescription medications are at risk of contamination, so is every other supplement on the planet. And now we've gone so deep into a rabbit hole with questionable evidence that we risk losing what is important in the long run. Sustainable changes to our lifestyle that ultimately have an internal loci of control. That's why I always tell you guys on YouTube that you have more power over your health than you've probably ever been told. It's a combination of external loci, but also our internal loci. And that's why I direct my Ketamine Infusion Clinic, where I help patients discover their inner healing potential. If I sell anything, it's selling your potential as an individual, hopefully not needing external supplements. No, when necessary, they can be very helpful when safely done so with an eye towards a sustainable, cost effective, non overly intrusive application in patients' lives. But when someone's life is in your hands and you're making a recommendation, I really hope that health gurus out there really understand the evidence of what they're talking about, understand how it would apply to a patient's life, and would be comfortable looking that patient in the eye or their loved one and say that there's risks to everything. I truly believe the benefits of XYZ compound or supplement or energy drink or whatever outweigh the risks for your loved one. And I'm willing to take on the responsibility of making that recommendation to you. It's hard to do in person. That's why we go to school for years and years and years in medical school and residency and fellowship and further training afterwards. But unless someone can look you in the eye with that much compassion and care and the knowledge to back it, I would be critical and suspicious of outlandish claims, especially if the loci control is somewhere out there and risks disempowering you as the patient. With that said, let's answer a couple questions. I love all of the positive comments here. And Heidi J. Coopville, hey, good to see you, Sam Master, from all over the world. I love it. Greg Bartel Bailey says hard work for a lifetime is tougher than pills for a lot of people. Greg, you're right. And the beauty of medicine is finding the hard work that we're passionate about that can be sustained for a lifetime. And that's why there isn't just one blanket answer to patients' questions. You know, if it's high blood pressure, you could take the pill, you could eat a certain diet, you could do certain physical activities, and you should hopefully do a little bit of each to minimize the risks of any one of them. But you have to end up picking what resonates with you so that it doesn't become a struggle for your life. It becomes something that you end up enjoying and can sustain for the rest of your life. That is how we tap into the inner healing potential, by not letting our health become a chore, but letting it be what we enjoy doing. Because the happier we are, the healthier we're probably going to be. Hey, Adventures Rob. Media often headlines with information not refereed by journal examiners, not validated. You're right, Rob, 100%. Robin, good to see you on. And let's see. Sailboat says, Heidi, one of the best things I ever did was take biofeedback. I have to get MRIs frequently for MS. I'm sorry, Sailboat, that you struggle with that. I've fallen asleep in them practicing the biofeedback techniques I've learned. Well, sailboat, you nailed it. Biofeedback is one of the most powerful built in ways that humans can learn to control so much of their body. Doesn't mean that medications are not necessary, because every week people just bombard me on social media. Dr. Cave, you think medications are never necessary? How dare you? You're an anesthesiologist. You give medications every day. Are you a hypocrite? No, I'm saying that they're necessary in the right context when the benefits outweigh the risk for the duration of therapy. Biofeedback, as far as I know, has never led to any appreciable risks compared to the bajillions of annually complications from medication side effects, supplement side effects, etc. So biofeedback is incredibly powerful. I love that you've experienced the benefits, Sailboat. Uh, Coop said, okay, Coop, I'll end with you here because you're raising an important point. And this is why health gurus online, I mean, I don't really know how to interpret what they're saying when every individual has such an individualized experience like you do. Coop Deville78 is saying the only pharmaceutical they're taking is doxycycline. We call it doxy, right? But my infectious disease doc said I had to take it for life. I have osteomyelitis or had osteomyelitis. Well, Coop, you're talking about osteomyelitis. This is not a joking matter. This is a serious infection, goes inside your bone. And for, I don't know what other medical conditions you have, but it is a very different case of somebody taking lifelong doxy, a relatively safe, not entirely safe, but relatively safe antibiotic for the risk of recurrent osteomyelitis. I mean, this is, just goes to show how in medicine, it's not one size fits all. You're not the average patient who I would say, get off all medications. Some patients, I do want them to get off all medications, but obviously you're not one of them. But I have to understand osteomyelitis, the risks of doxycycline compared to the risks of osteo coming back are very, very, very serious, just like for omega-3s, just like for metformin, for ranitidine, etc. All right. Okay. Here's an easy one. Softball from Greg. Can anesthesia cause my heart to go into AFib? Yes, it can. And Sue. Oh, this is so kind. Sue says, the interest for me is you are the only medically trained doctor willing to look at natural therapies. It's unheard of where I'm from. Having said that, as a claustrophobic, how do you deal with us? Claustrophobic? Well, Sue, first of all, thank you for the kind comments. You got me to stay a little bit longer. I was about to say goodnight, but that was very kind. How do I deal with patients with claustrophobia? If that's the question, Sue, depends once again on the context. If I'm in the operating room, I always want the patient to be in control because that mask that goes on your face before you fall asleep can be intensely anxiety provoking or claustrophobic invoking. So I actually ask the patient to hold on to it themselves because it helps, hey, internal loci of control. That's what I do in all of my ketamine assisted psychotherapy. When I'm helping somebody in the operating room go through the most anxiety provoking part of their life before surgery or after surgery, it's all about the internal loci of control and helping patients recognize that they have more power over their health than they've probably ever been told. And in the case of claustrophobia, it depends on, are you in the OR? Are you in an elevator? Are you in, gosh, I don't know, a submarine? It depends on the situation. But the more in control we are in the situation, the less likely the claustrophobia, anxiety, and phobia is to take over. It can take exposure therapy, either with beta blocker association, with biofeedback. There's many ways to address it, but it comes down from attaining control. Alex, good to see you. I'm sorry that you missed the beginning as well, Alex, but you can always watch this recording from the beginning. We talk about all sorts of fascinating things that health gurus online don't talk about, and it can end up hurting patients. Just as a little plug, you know that I don't do product placement here because I don't want to put the loci control somewhere else. But I would appreciate it if you hit that subscribe button, if you share what you've learned with other people to help empower your friends and loved ones to help recognize their inner healing potential. I do direct a ketamine infusion clinic where I help patients overcome the most challenging mental and physical health conditions, often with the power of their own inner reflection and being able to tap into that inner healing potential. So medications are great, and Western medicine saves many lives. It also hurts many lives out there. So learning the risks and benefits are what we do in medical school and how we can best treat patients like yourselves out there. So I wish you all the best. I hope you learned something new. And remember that you have more power than you've probably ever been told. Until next time.